Fortunately for many of you, acne is going to be a short-term issue that's going to last throughout your teenage years, and it will start decreasing and diminishing as you approach the end of puberty. So that is the good news. But for some people, about 15% of females and 5% of males, it continues beyond the post-pubertal years. So it continues and takes on another form and becomes adult acne. And that is where the issue arises. You are suffering from acne and you have done everything under the sun. So you have taken professional treatments, you have tried home management, you've tried all those cleansing devices in the market and the different home care kits that are available for acne. You have done blue light, you have tried blue light treatments, you have tried LED light treatments, you have tried everything that you can do, and also you are pretty vigilant and compliant with treatment. Still, your acne is not healing. Your acne is not budging. There's hardly any improvement. What can be those important reasons that are interfering with the healing of acne, or even in fact making acne worse? What are those important factors? And I'm going to highlight those factors for you. If you see this slide, I've highlighted some of the important cosmetic ingredients that you should watch out for. So cosmetic acne is known as acne cosmetica. It is a clinical entity. And what this does is cosmetic acne actually blocks the pores. It actually creates a hypoxic environment within the pore. And P. acnes, which is the bacteria that actually causes acne, loves low oxygen. It does not thrive in oxygen environments. So when your makeup or the ingredients that I've mentioned actually block the pores, example foundation, you will create an environment of hypoxia within your pilosebaceous unit. This is going to lead to the proliferation of P. acnes, and your acne will start to worsen again, and you will have the development of, in fact, even new acne lesions. So what is the solution here? The solution is that, fortunately, in cosmetic acne, once you stop using the irritating product or the ingredient, your acne actually will become better. It will heal and you will see improvement. So first of all, avoid those ingredients, avoid those products that are actually worsening your acne. And number two, please buy products that say non-comedogenic. So they have been formulated specifically for acneic and oily skin. So those are the points that you need to keep in mind, and this will take care of cosmetic-induced acne or the worsening of acne due to the application of acne-causing cosmetics. Other important reason that your acne may not be improving is stress. Stress and skin is a very valid, a scientific connection, and if you want to know more, please visit my YouTube channel, Cuticonscious Skincare Consultants. I have done an entire lecture on the effects of stress, the effects that stress has on skin. So have a look at that and you will understand how stress is actually worsening certain skin conditions, and that includes acne. So there is a very strong connection with your mind and your skin. It is in fact a primal connection, because eventually your skin is actually derived from the layer of the embryo that produces the brain. You are vigilant. You are applying topical and antibiotics and taking antibiotics orally as your doctor told you to, but your acne is not improving. In fact, it's even getting worse. What is happening here? You have developed antibiotic resistant acne. This is one of the commonest kinds of issues that we face in the outpatient department. This is acne that is resistant to topical and oral antibiotics. What has to be done here? Well, your dermatologist is going to try to use other treatments and other drugs that are not going to cause this issue. So benzoyl peroxides, azelaic acid, retinoids, blue light if available, IPL for acne is a new modality, but that also can be tried. So anything other than antibiotics will solve this problem. So this is one of the reasons why your acne is not improving, is because you actually have developed resistance to the treatment, or to the antibiotic treatment. So please keep this in mind. If you are applying your antibiotics and taking them orally and your acne is not improving, you must let your doctor know, because then they will shift from monotherapy, that is using one drug, and they will try to add on other treatments, and in fact even lessen the use of antibiotics, because antibiotics are eventually, in so many people, they are going to lead to resistance. So hence it's better to use them as less as possible and try to complement them or try to replace them with other acne treatments. And this is going to solve the problem of antibiotic resistant acne. All these factors do not apply to you. So you are controlling your stress levels, you're using non-comedogenic products, acne-specific products, you're using your prescription products in a careful manner. Even then your acne is not improving. Well, then it is genetics. Acne has a very strong genetic link. You have 4 times more risk of developing acne if your first degree relative has acne. That is how strong the genetic link is. In this case, unfortunately, we cannot do much. But what can be done is that you can be very careful about your lifestyle measures, about what you apply to your skin, and of course about the treatment products. So all these together form an entire spectrum of acne care that has to be taken into consideration when you have genetic acne, because this is going to be then a lifelong chronic illness that you have to deal with on a daily basis. So you really need to take care of your skin. If you have the inherited arm of acne, it's going to be a long process, but you will get there if you are very careful about what you are doing to your skin and your diet and other lifestyle measures that will help you along the way. Next in line is smoking, nicotine smoking. What does nicotine smoking do? First of all, nicotine smoking is quite damaging to your skin. It will result in the generation of very dangerous free radicals. These are unpaired molecules that are actually going to damage your skin at a deeper level. These are DNA damaging particles. Nicotine is going to release that. What will this do? This will result in an oxidation of your sebum. When your sebum or your oil is oxidized because of these free radicals that have been generated because of nicotine smoking, those byproducts of sebum oxidation will actually result in acne formation, blackhead and whitehead formation. So it has been found that nicotine smoking is going to release or increase ROS, reactive oxygen species. This will result in sebum peroxidation or oxidation, and the byproducts of that will result in blackhead and whitehead formation. Next, smoking will also lead to cutaneous vasoconstriction, narrowing of your blood vessels within your skin. This will result in hypoxia or lowered oxygen levels. Lowered oxygen levels means less oxygen to the sebaceous gland and to your surrounding tissue, and less healing of your acne lesions. Number 3, nicotine smoking will also result in delayed wound healing. So several studies have identified that nicotine smoking will result in diminished or delayed wound healing. This means that the acne lesions will heal very poorly or respond very slowly. So this is why you may be doing everything under the sun to help your acne improve, but you have not given up, or you have not quit smoking, or you are still smoking. Nicotine smoking is not conducive to the health of acne healing. It's not going to help you along the way. It will worsen your acne, and your acne lesions will simply not heal whatever you do. So what else is happening? The other factor that is responsible for the non-responsiveness of acne or acne that takes a long time to heal are steroids. So the topical application of steroids and the ingestion of steroids. What steroids do a couple of things, but what they do mainly is they result in a proliferation of the oil glands. So they stimulate the oil glands or your sebaceous glands. They will proliferate, they will secrete more oil, resulting in a blockage of the pores and the development of acne. The other thing that they do that is quite dangerous is they have a vasoconstrictive effect. So what they do is they narrow the blood vessels in your skin. When your blood vessels are narrowed, there will be less oxygen supply. Now remember that I told you that P. acnes loves a low oxygen environment. So P. acnes is going to grow and grow and grow, and this will of course result in a worsening of acne or acne that simply won't heal because you are having a vasoconstriction of your blood vessels and low oxygen supply, and P. acnes loves that. The other dangerous thing that steroids do is they have an immunosuppressive effect, and this is why we use them in dermatology and in medicine. They suppress your immune system. This is not good for your skin because in the case of acne especially, what will happen is you have a nice, happy flora or microbes, bacteria, and a mix of other microbes living in your skin. They are responsible for the health of your skin. They are very important. They are known as the skin microflora. But what happens when they start to overgrow? So when your immune system is suppressed, things go unchecked. So those bacteria, those happy and those commensal and those normal bacteria will overgrow, and the flora will overgrow. This will result in a super antigenic response. So what will happen is the bacteria is overgrowing, the microflora is overgrowing. They will result in a super antigen, which is going to irritate the skin and result in an immune-mediated inflammatory response. So you are going to keep on applying the steroids for whatever reason or for another skin condition, and you will notice that your acne is not improving and worsening. It's because of this. So your immunity is suppressed, your flora is going to overgrow, the blood vessels are narrowed, so you have less oxygen supply, P. acnes will overgrow, and then of course, as I mentioned, that the oil glands of course are stimulated and you will have more oil production. So this is why steroids have to be used very judiciously. Please do not abuse the use of steroids either orally or topically, because this is really going to worsen your acne, and acne will never improve. So the good news is that when you stop the application of steroids gradually, please don't suddenly stop steroid use. So gradually stop and taper the steroid use. You will notice that your acne will actually start improving. So this is the role of steroids in the non-responsiveness of acne. Other reason why your acne may not be improving is because you may have an internal issue or an internal disease. For instance, polycystic ovarian syndrome, present in 2 to 20% of the female population. This will result in lifelong acne. So you need to get treatment for the polycystic ovarian syndrome. Other genetic disorders or hypervirilizing disorders, anything that's going to increase the levels of testosterone or steroids, including cortisol, within your blood will result in acne, and hence your acne may not improve despite all the measures that you have been taking. Please keep this in mind. These issues need to be looked at by your physician or your dermatologist. Next are drugs. There are certain drugs that worsen acne or actually even may lead to the formation of acne. This is known as drug-induced acne, DIA, and this is a clinical entity. So certain psychiatric medications such as lithium, antidepressants, halogens. Halogens are basically iodides and bromides, and they can be found in the simplest of things, such as cough syrups, asthma medications, citrus soft drinks, Coca-Cola. All of these contain iodides and bromides, and they will not help your acne. And then, of course, you have the anti-cancer drugs and the TB medications. All of these will result in acne. The good news is with DIA or drug-induced acne is when you stop using the drug, your acne will actually become better and it will heal, and you will notice the difference within a few weeks. So upon discontinuation of the drug in question, your acne lesions will actually start to heal, and you will see a clearing up of acne, and you will also notice that your skin is doing much better than it was when you were on that drug. So keep this in mind and make a note, make a diary. If you are on these certain medications that I've just mentioned, is your acne getting worse or is your acne improving? If your acne is getting worse, especially when you started this drug, then definitely you have DIA or drug-induced acne. You need to mention this to your physician. So what if none of these factors applies to you? You are doing your best and all these factors here do not apply to you and your acne is not improving. It may be due to pollution. Even though the evidence is very scant, just a few anecdotal studies here and there, but it has been shown that pollution may worsen acne because outdoor pollution especially is something that we cannot control it, and it contains a very large blend or a mix of toxins. So you have particulate matter, you have air toxins, you have sulfur dioxide, you have nitrous dioxide, you have ozone, and then of course you have the dust and the smoke. All of this is going to block the pores, resulting in a low oxygen environment within your skin, which is really going to make your P. acnes so happy, because P. acnes loves to live in a low oxygen environment. Anything that, so therefore smoking, pollution, anything that is going to reduce oxygen levels within your skin is going to worsen acne. So we have some evidence that pollution may be linked to the worsening of acne or acne that is not healing properly. It may be that you are living in a very polluted city or area and you have not been cleansing properly. So you need to cleanse, and how we can tackle this is you need to cleanse, you need to apply barriers and emollients to form a thin layer on your barrier or your skin, so the pollution or the pollution matter or the materials, the toxins cannot enter as easily as they would if you do not apply an emollient. So skincare is important. So cleansing, double cleansing if that is what you prefer, but not over cleansing definitely. So proper cleansing, good skincare, a good skincare routine, and definitely the application of antioxidants and emollients. They are going to take care of any pollution related damage that may be happening on your skin if you have acne. So there we have it. These are some of the major factors that may result in the non-responsiveness of acne, or acne that responds very slowly or takes a long time to respond. Try to identify these different factors. Are any of these factors present in your life? Are you doing anything out of the ordinary, especially in these factors that I've mentioned, that may be resulting in acne that is not healing as well as it should? So please keep these few factors in mind. There are, of course, lifestyle changes. There's a diet link. There's so many things. I can go on, but I wanted to just focus on these few to begin with. And if you have any questions, please comment below. Don't forget to subscribe to my channel, Cuticonscious Skincare Consultants, where I will bring you original research-based content that also is based upon my practical life as a clinician. I will offer you all those tips that are going to help you along the way. So please pass along these videos to your friends, to your colleagues, to your loved ones, anybody who can benefit from these tips. Just pass along my video. Don't forget to subscribe, and don't forget to visit my Instagram, because Instagram I post daily pro secrets, inside secrets, stories, updates, industry updates. I do that on a daily basis. So my stories are actually mini lectures. So on my YouTube channel, I post these slightly longer lectures on different topics, but my stories are mini topics on various pro, inside, dermatology and skincare secrets. So don't forget to visit my Instagram. Do follow my Instagram. Pass it along to your loved ones and friends. And I hope to see you next time with another useful topic that can be useful for your daily life. and that can be helpful along the way. So take care, everybody. Stay safe, stay well, and please say a silent prayer to George Floyd and his family and all those fallen heroes who have suffered at the hands of racism and racial prejudice. So this is so important. So please say a prayer for that poor lost soul, and may this world heal, not only externally but also heal spiritually. So take care, everyone, and let's meet next time with another amazing topic.